Have you ever faced a moment where you knew what felt right, but struggled to explain why, especially when big decisions are on the line? Understanding how to articulate the reasoning behind your choices is not just good practice, it is essential, particularly in healthcare. Justifying an ethical decision means providing a clear, logical explanation that connects your choice to established ethical principles and frameworks, demonstrating that it is a well-reasoned and morally defensible course of action. It is about moving beyond a gut feeling to a structured argument that others can understand and evaluate. The core mechanism for this justification often lies in what is known as principlism, which relies on for foundational principles in bioethics: autonomy, beneficence, non-maleficence, and justice. When you justify a decision, you are essentially showing how your choice upholds one or more of these principles, or how you have carefully balanced them when they appear to conflict. This systematic approach provides a common language for discussing complex moral issues. To practically justify an ethical decision, start by identifying the core ethical dilemma and the various options available. Next, list the relevant ethical principles that apply to each option, such as respecting a patient's autonomy to refuse treatment or acting with beneficence to promote their well-being. Then, consider the potential consequences of each option, both positive and negative, for all stakeholders involved. Finally, construct your argument by clearly articulating which option you chose and how it best aligns with or prioritizes the most salient ethical principles, explaining your reasoning for any trade-offs. One insider tip is to engage in what is called a four-box or Johnson model analysis, which systematically reviews medical indications, patient preferences, quality of life, and contextual features. This comprehensive approach helps ensure you have considered all critical dimensions of a case, solidifying your justification. Another valuable tool is to consider ethical precedents, looking at how similar cases were resolved by ethics committees or through professional guidelines, adding weight and consistency to your reasoning. Ultimately, the ability to justify an ethical decision transforms subjective conviction into objective reasoning, promoting transparency, accountability, and trust in healthcare and beyond. By grounding your choices in recognized ethical principles and a thorough analytical process, you ensure that your actions are not only well-intentioned, but also robustly defensible, leading to better, more compassionate outcomes for everyone involved.